Hey guys, it's Dr. Nate here at Thrive Dental Orthodontics, and today what I'm going to do is I'm going to talk to you about the difference between a healthy mouth cleaning or a prophy cleaning and a deep cleaning. Hey guys, today I'm going to explain the difference between a deep scaling and root planing or deep cleaning and a prophylaxis cleaning or prophy, or sometimes called a healthy mouth cleaning. But first I need to explain to you the difference between tartar and calculus and plaque. So there's some different things here. Plaque is that stuff that you have on your teeth sometimes after eating or not brushing for a little bit, and you have this kind of white, kind of nasty stuff, but you can clean it off yourself. If you're using your toothbrush or your Sonicare or any of those good devices, you can get that off yourself, no problem. Calculus and tartar, you cannot get off yourself. And that is the stuff that's bonded on there really, really strong. It's sometimes below the gum line, sometimes it looks yellow, white, looks something like that. And it's underneath the gum tissue a little bit, and it's on there hard. And we need to use different instruments. We need to do stuff like this or Cavitron. We have all these different instruments that we use to get off that material right there. So that's the difference between calculus, tartar, and plaque. So big differences there. So let's go back. So let's talk about the difference between a healthy mouth cleaning and a deep cleaning. So healthy mouth cleaning is when you're just basically cleaning the surfaces of the teeth and you're not really going below the gum line. So that's when people don't really have much gingival disease, they don't have much bone disease. They pretty much have relatively healthy gums, and we're just cleaning the teeth, polishing it, make sure it looks really nice and healthy and really nice and good. And that one, that's a healthy mouth cleaning. That is quite a bit different than a deep cleaning. So deep cleaning is when you're actually going below the gum line and you're getting all that calculus, that tartar, all that nasty stuff out of the mouth. And that involves using the Cavitron, all these special instruments that we have, including some of the instruments like this, to make sure you get off all that tartar, all that calculus, all that plaque, so they have a beautiful, healthy teeth, healthy gums, good breath, and all these other benefits that come along with that. So what happens when you come in and we recommend you to get a deep cleaning, but you say, nah, you know what, I just want to get that healthy mouth cleaning, or I just want to get that prophy. The reason we do not want to do this is a couple of things. So let's talk about the finances first. So if you have insurance and you come in and you say, hey, you know what, I know I need that deep cleaning, but I just won't get that prophy, and we go, okay, whatever, we don't recommend that, but we'll do it. And we clean it, we make the teeth all nice and shiny, but we don't get the real disease, but we make the teeth nice and shiny. But then, 3, 4, 5 months goes along and you go, you know what, oh my gosh, I have this bad breath, I have all this disease, I want to get that deep cleaning. We can do that. The problem is the insurance company goes, hey, you had that healthy mouth cleaning and now you're going to get that deep cleaning. That doesn't make sense to us. So we're going to deny everything. So they're going to make you pay out of pocket the full amount of that deep cleaning. So you will not have any benefits from your insurance. So financially, it doesn't honestly make sense to do a prophy now and then a deep cleaning later, because your cost is going to be triple or quadruple, or it's even more than that. So that doesn't make sense financially. It just doesn't make sense. So that's one reason. The second reason is just your overall health. So I'm going to try to do my best to explain this. Say this is your tooth right here, and this is all your gum tissue. So this is below here is all your gum tissue. If we just do a healthy mouth cleaning, boom, we clean all this stuff, we leave the tartar calculus plaque underneath the gum tissue. What happens is your gums then overgrow it, and it kind of forms this tight little junction here. And so when you're brushing, flossing, and doing all your oral health care, you don't come close to this. And that is not good. That means you're gonna have bad breath, absolutely. You're gonna have worse gum disease, because that stuff down here is just gonna grow and grow and grow. You're gonna have all this bone loss too. So now the bone may have been here, your teeth are nice and strong, the bone gets lower and lower and lower and lower and lower, all of a sudden your teeth become mobile, and then you can't keep them for that long. So there's so many reasons to get that deep cleaning now rather than wait later. Not only are you gonna have better breath, better overall health, you're gonna keep your teeth longer. It just makes financial sense too. So there's so many reasons we recommend that if you do need that. So I hope that helps to kind of explain the differences between a healthy mouth or prophy cleaning versus a deep cleaning, and hopefully you understand the differences a little bit between plaque and tartar and calculus. So that's why we're recommending those specific treatments. So definitely, if you have any questions or comments, please leave them below so I can help answer any questions you have next time. And thanks for watching. All right, guys, thanks for watching. And once again, please subscribe below. And if you have any comments, questions, also please leave them below. And I will try my best to answer all your questions. Thank you so much.